My name is Melina Manolas, and I am an endocrinologist. My role is to see general endocrinology patients, but also to see patients in the ICHANGE clinic, specifically patients that have overlap between metabolic liver disease and other endocrinology conditions.
And I'm Buckholz. I'm an assistant professor in gastroenterology and hepatology. So most of the patients I see have liver disease. And as part of that, I work in the ICHANGE clinic, which is our GI and metabolic health center, where we see a lot of patients who have specifically MASL or fatty liver disease. ICHANGE kind of came out of this understanding that in order to actually make the liver better, you have to figure out how to improve other parts of the body.
As a resident, when I was doing my internal medicine training here, I did a rotation through ICHANGE, and I saw how wonderful it was for patients to be able to see an endocrinologist, even a nutritionist, get a liver scan, see a hepatologist all at the same visit, all integrated care. And then on the flip side, on the provider and the physician side, all of us sitting together in that same workflow and having conversations with each other about management, I think is really unique.
We know that it's the most common chronic liver disease in the world now. Almost a third of Americans have some fat in the liver. This is a chronic condition, and it needs a sort of chronic approach, and it needs people who are sort of willing to understand the whole body.
The first step is just making sure we're screening enough, and that's part of my role. And then the second step is if they are found to have advanced chronic liver disease, working as a team to kind of make sure that they're managed both at a lifestyle and a medication perspective.
And what we try to help them understand is that one, we need to monitor this because it can get worse, but also it can get better.
Right.
And there are steps you can take to make it better. And usually having fat in the liver is a sign of other problems with metabolic health.
Yeah.
And so sometimes we'll treat it as kind of an alarm bell. And that is actually what's so rewarding, is that we don't necessarily think, oh, you have to either have fat in your liver or not have fat in your liver. That's not our only goal. We're also trying to achieve goals for metabolic health for patients, whether that's weight loss, diabetes control, and really having a lot of people in your corner can be helpful to try to get there, because we know that this is a difficult condition that a lot of people struggle with.